Testing of the injectable vaccine will begin next year. The World Health Organization estimates that over 400,000 people die from the disease every year, many of them young children. The vaccine is being developed by the British drugmaker GlaxoSmithKline. I've been speaking to the journalist Lucy Taylor, who's been following the story from Dar es Salaam. She says initial tests of the vaccine have proved very effective.
Well, this is a really significant breakthrough, simply because this is the first vaccine which has ever got this far in testing. It's already been tested on 16,000 children in 7 countries, and it's past the critical third phase of clinical trials, meaning simply it appears to work, it appears to be safe. It's been given approval by some of the world's foremost experts from the European Medicines Agency and from the World Health Organization, so this is significant. It's a simple intramuscular injection, similar to other vaccines you may have seen or may have had yourself for other diseases, and it's designed for young children between the ages of 5 and 17 months old. It's designed to protect them from the most deadly strains of malaria. And this new pilot program, as you say, across Ghana, Kenya and Malawi, and it's going to be huge. It's going to affect 750,000 children. Half of them will be given the vaccine, the other half of them will be used as control. So far from what we've seen, it does seem to be effective in about 4 out of 10 cases. But these were in very strict clinical trials, very tightly controlled. And even that is slightly less than other vaccines for other illnesses. But still, the World Health Organization says that 4 out of 10 cases, that could save tens of thousands of children's lives. But you're right, there are drawbacks, and this new pilot program is more of a feasibility study, really, to see how effective it can be in real-life conditions. Can parents living in developing countries across Africa, perhaps living in poverty, maybe living far from the local health facilities, can they get their children to the clinic to receive 4 doses of the vaccine? And what happens, how effective is it if they don't or if they do? Well, aid organisations have a target of eradicating malaria by 2040. It's very ambitious. Perhaps it's too soon to say if that will happen, but there is some promise, partly because of the amount of funding that is being put into research, both for prevention and for treatments. And it's not just this project. There are a number of others in the research phases at the moment, which we may see come to fruition over the next few years. But as you say, this is absolutely critical. There are still 200 million new cases of malaria every year, 500,000 deaths. Most of those are young children living in Africa. So this is very important. Until one of these treatments or preventions comes to fruition, we'll have to rely on what we have at the moment. And researchers say right now the most effective prevention of malaria is the most humble, sleeping under a mosquito net.